So hello guys, today we are going to study one of the most important topic of lower limb part of anatomy. This is nothing but femoral triangle. Okay, so one thing you should remember in anatomy, you should try to cover most of the content through diagrams rather than theory part. Okay, so let's start. So firstly I'm going to tell you about the femoral triangle. It is a triangular structure which is present in the anterior part of thigh, be, present below the inguinal ligament. So now directly coming to the things which you have to draw or you have to write in the theory exam. Firstly, talking about the boundaries of femoral triangle. So the medial boundary of femoral triangle is found by medial border of adductor longus muscle. The lateral boundary is found by medial border of sartorius. The apex is found by the junction of two muscles at the intersection point, and the base of triangle is found by inguinal ligament. You know inguinal ligament, attachments of inguinal ligament. This is ASIS. This is pubic tubercle. So we have done the boundaries. Now talking about the floor of femoral triangle. So the floor of femoral triangle is formed by four muscles. See, one important thing, the adductor longus muscle, its medial border forms the boundary of femoral triangle, but it is also a content of floor. It also forms the floor of femoral triangle. But the same thing is not true for sartorius muscle. So you should remember this thing. So the four muscles which are involved in the floor of femoral triangle are iliacus, psoas major, pectineus, and adductor longus from lateral to medial. You should try to remember these muscles: iliacus, psoas major, pectineus, and adductor longus. So these were the muscles forming the floor of femoral triangle. Now talking about the contents of femoral triangle. Sorry, I have left the roof. The roof is formed by fascia lata, which is having saphenous opening also, and it also has superficial nerves and arteries. Okay. Now talking about the contents of femoral triangle. Okay. See, femoral artery, femoral vein, femoral nerve. All three are contents of femoral triangle. Then deep inguinal lymph nodes and lateral cutaneous. See, we should simply draw this diagram. Okay. This is the main diagram for femoral triangle. Firstly, you have to remember the sequence of structures from medial to lateral. Medial most structures are lymph nodes. Firstly, you should remember femoral sheath is present most medially. Okay. And the sequence of structures are VAN, femoral vein, femoral artery, and femoral nerve. You should remember this sequence, VAN from medial to lateral. Okay. Some people do this mistake. They draw structures in the left and the right side and right and the left side. Now talking about other structures. Lateral cutaneous nerve of thigh. This is the lateral most content of femoral triangle, and it is very important because it has a clinical significance. The injury to lateral cutaneous nerve of thigh can lead to myalgia paresthetica. You should remember this. This is a MCQ. Now talking about femoral sheath. See, this is the modification of fascia which encloses certain structures in the femoral triangle. It is not shown here, but you can see it separately here. It has further three compartments. Okay, medialmost compartment, medialmost compartment, intermediate compartment, and lateral compartment. So you should remember one thing: femoral nerve here. Femoral nerve is not a part of. It's not a content of femoral sheath. Okay, the contents of femoral sheath are femoral artery, femoral vein, and lymph nodes. Okay. So now also we have to remember the sequence from medial to lateral. Medial most structures are lymph nodes, which are also called as lymph node of Cloquet or Rosenmuller. Then we have septa, which is forming the separation between medial and intermediate compartment. In the intermediate compartment, we have femoral vein. And in the lateral compartment, we have two structures, femoral artery and femoral branch of genitofemoral nerve. Many people forget this structure, but you should remember it is present in the lateral compartment of femoral sheath. You can see this diagram. Here it is shown femoral branch of genitofemoral nerve present posterior to the femoral artery. So these were the main things which you have to consider in femoral triangle. Thank you.